So good afternoon, everyone, and welcome. My name is Amanda, and I'm DWDC's Program Coordinator. Today, I'm joined by my colleagues, Kelsey and Kat. Before we begin, I want to acknowledge that while we are meeting virtually, the land Dying with Dignity Canada is on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Indigenous, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and we invite and encourage that you do your own research regarding the various treaties, in particular the land in which you're on while meeting with us today. So I am thrilled to welcome you today. Through our webinars, we aim to provide you with information and key takeaways, as well as create a space for conversation on end-of-life topics alongside the professionals that know it best. Before I welcome today's speaker, I'd like to go over a few housekeeping items. Everyone on the call today is muted. However, there will be opportunities to submit your questions. To do so, please type your questions into the question bar on the Zoom side panel, and we will read it out for you at the end. In the interest of time, we ask that you please keep your question as concise and clear as possible. I also want to take note that during registration for today's session, we received a great deal of questions from our audience about advance requests. So thank you so much to folks who submitted. We want to share with you that we will have an action regarding advance requests available shortly. Make sure you are signed up for our newsletter and tuned into our social media accounts to hear how you can get involved. All right, and while we are going to try to get to as many audience questions as possible, unfortunately, we may not get to everyone. If you have any outstanding questions or questions that are quite personal in nature, please email us at support@dyingwithdignity.ca and we will follow up with you. This session will be recorded, so there's no need for you to take notes if you don't want to. And finally, there will be a post-webinar survey that will pop up on your screen after the webinar and will give you the opportunity to share your most valued feedback. And last but not least, I'd like to take a moment to spotlight our special project. In My Own Time is a documentary that looks at what it means to die on one's own terms. Using firsthand accounts from people across Canada, this film offers perspectives on medical assistance in dying less commonly seen in media reports and presents an opportunity to educate people on end-of-life choice in Canada. So on November 2nd, we hosted the premiere of this film in downtown Toronto alongside over 300 of our supporters. We were delighted to share that we are now offering additional in-person screenings across Canada. For more information, please check out our website to find out about screenings near you. And don't worry, if you don't yet see a screening near your location, additional opportunities to view the documentary are in fact coming soon. All right, and now to introduce today's speaker. Annette Laurent is a senior analyst in the end-of-life care unit at Health Canada. She is responsible for MAID data collection, analysis, and reporting under the federal MAID monitoring system established in 2018. Prior to taking this role in 2019, Annette was a senior analyst at Stats Canada for over 20 years, where she worked within different statistical and surveying programs, including national statistics. She holds a Bachelor of Arts in Economics from McGill University and an MBA, from the University of Ottawa. Annette is also an avid traveler, having traveled and explored over 25 countries of the world. Wow. Thank you so much to Annette for joining us today. She's also going to be flanked by her colleagues from Health Canada, Blaine and Michelle, who will join us later on for the Q&A portion of today's session. Annette has graciously prepared a presentation ahead of time, so I'm now going to pass the floor to her to get us started. Annette, welcome and thank you. All right, wonderful. I can see those slides and I'm sure everybody else at home can see those as well.
Super. Good afternoon, everyone. My name is Annette Laurent. I want to thank Dying with Dignity for the very, very warm welcome and for inviting me here today to present on MAID data. So I want to welcome you to this presentation on the 4th annual report on medical assistance in dying, which was published on the Health Canada website in October of this year. As Amanda said, I joined the MAID team in early 2019. I've worked on MAID data and reporting since the first report, which was published in 2020. I absolutely love data and how it can tell a story about a subject and inform discussion and progress going forward. So I'm really excited to see that there are so many people here today who are as interested in data as I am. So without further ado, I would like to say, just as Amanda said, for questions related to the report, we'll be happy to take those at the end of the presentation. For other questions related to the legislation, we would invite you to to refer to our website. So if you search up endoflifecare@canada.ca, you will find that. And I would like to acknowledge that I am grateful to work and live on the traditional unceded territory of the Anishinaabe Algonquin Nation. All right. So just to set the context for reporting, I'm going to start by talking about 4 key dates. 2 of those dates relate to the actual legislation and the law, and 2 of those dates relate to the regulations. And it's the regulations that govern reporting, and it's reporting that we're going to talk about today. So it's important to set that context. The first date is June 17th. So on June 17th, 2016, the Parliament of Canada passed the original MAID legislation, and that allowed eligible Canadian adults to request and receive medical assistance in dying. The second key date has to do with the MAID federal monitoring system. So on November 1st, 2018, we published the regulations for the monitoring of medical assistance in dying. So these regulations, they provide the framework for the collection, analysis, and reporting of information related to MAID. And it's really, in a nutshell, how we're able to collect the information and the data that forms the basis for the annual report. On March 17th, 2021, the law was revised. So many of you will know that the law was revised to permit MAID for individuals whose death was not naturally foreseeable. And at that time as well, we began the plans for the regulatory amendments. And so those came into effect on the 4th date, which I'm going to talk about, which is January 1st, 2023. So these amendments, they talk about enhancing our data collection, and they will take place in 2023 and beyond. So essentially now we are collecting data this year in 2023, and that data will be published in 2024. So important to understand that today we are talking about the original data that is collected under the original regulations, and then the new regulations will influence the data going forward, starting this year to be published next year. All right, so who is responsible for reporting? In Canada, it is all practitioners. So we have physicians, nurse practitioners, preliminary assessors, all practitioners who assess and provide MAID, as well as the pharmacists who dispense drugs for the provision of MAID. They are responsible for reporting to Health Canada. So in their report, practitioners may ask questions to the individual requesting MAID, and they may include this information in the report, and I will talk about that information in a few more slides. The information is then submitted once it's collected and put together. That report is submitted by the practitioner to Health Canada. So it's not the individual who is requesting MAID that has any responsibility in that, although some information that they provide will be included in the report. In some jurisdictions, the practitioner may submit the report to their province first. There are some provinces that have provincial bodies that receive those reports, then they send them to Health Canada. So one way or the other, all the reports end up at Health Canada at some point during the year. And so today we'll talk about the 22 annual report. It includes data collected, as I mentioned, under that second key date, which is the original 2018 regulations. So reporting is important. It's important that to support accountability, transparency, and it fosters public trust in the application of the law. The whole point of reporting is to be transparent in the results and trends that we see and to report to Canadians on this. All right, what data is reported? There is a lot of data in the annual report. Today I'm going to present a subset of that, but there is quite a bit. There is a form for practitioners to fill out. It includes things like an individual's date of birth, their sex, a health insurance number, their main conditions that are leading them to seek MAID, whether palliative and or disability services were received by the individual, how the individual describes their suffering, and location where MAID was provided. That's just a few of the elements. There are others, and you'll see them throughout the annual report in the charts and tables that are presented, but those are some of the main ones. And so with all of this information, at the end of the year, then the annual report is prepared and published in the second half of the following year. So for example, 22 is over now. At the beginning of 23, we closed up the year at January 30th, once we got all of the reports in, and then we begin to analyze and publish the 22 data in 23. So to date, if you go to the website, there are 4 full reports. There's under the original regulations. There is the 2019, 2020, 21, and 22. So the reports are not exactly the same, each of them, but they do follow a similar format. And so that's to help people be familiar and comfortable reading them each one by one if they choose to do so. Each one builds on the previous one, and each one allows more year-over-year comparisons. So it builds trend analysis, and that's what makes it really interesting. And so while as we might make slight revisions to the previous year to include a late report, for example, for the most part, each report is comprehensive, and it can be considered to be an excellent reference for the year in question. So if you're interested in a particular year, you can be welcome to pull up that specific year. If you're looking for the most recent, then in the 22 report, we do have trend analysis that shows the 4 years in cases where that is relevant. So as mentioned, the goal of the report is to fulfill the legislative requirement to be transparent, to report to Canadians on what we see. And we do report as much data as we can, but we also are very cognizant and respecting confidentiality. So that is really important to us. Sometimes in the report, you will see detailed tables and you might see some blank cells or cells with dashes in them. This is to protect the confidentiality in areas where there are small numbers. So we take that really very, very seriously. All the reports are posted on the Health Canada website. Here is the search terms, and you will find them there in HTML and PDF format. All right, so let's get into the data now. In this chart, you're going to see, this is the first chart that we present at the top of the report. You will see the total number of MAID provisions since 2016. So as I mentioned in the slide with those key dates, the original MAID regulations, they began on November 1st, 2018. So that's when detailed data reporting actually began. However, prior to this time, we did have interim data that we collected from the provinces and territories, and that was shared with Health Canada. And so what that allowed us to do was to get the numbers of MAID provisions and some pretty high level information for 2016, 17, right up to November 1st of 2018. And that's how we're able to build this historic table over time. Knowing that in 2019, that's when the details really began, and we were able to produce more fulsome reports. So what we can see in this table, or in this chart, in 22, there were 13,241 MAID provisions in Canada. And so this accounted for 4.1% of all deaths in Canada in 22. The total number of medically assisted deaths in Canada since 2016 is 44,958. So what you can see here as well is that growth has been pretty steady over the years, and calculated from 2019 to 22, there is an average growth rate of 31% each year in those 4 years. Now, what you can see here in this table is those solid blue bars. So the majority of MAID is provided for individuals who are close to death, or in other words, death is naturally foreseeable. And this is shown by the solid blue bar that you see in all of the years, except for the last 2 years. In 21 and 22, you see the small red bar at the top, and this shows the data for the MAID provisions where death is not naturally foreseeable. So that is part of the new law and that date that I mentioned where the law changed in 21. So in 22, sorry, this was 463 individuals. And 21, it was 226 individuals. So very small numbers. And you can see those reflected in the little red slivers at the top of those solid blue bars. In 22, the not foreseeable natural death was just 0.14% of all deaths in Canada. So in other words, the majority of MAID is provided for individuals who are close to death, or in other words, where death is foreseeable. All right, this is a busy but fun chart, and I will walk you through it. It is another fun 4-year chart. It shows the total MAID provisions split up by jurisdiction. So in this case, we have the provinces from east to west, Newfoundland through BC. And I'll just mention at this point that I did briefly touch on confidentiality, and this is where confidentiality comes into play. The numbers for the territories are very small, so we do drop them off some of our charts. It is not on this chart or any chart in today's presentation, and the reason for that is confidentiality. So counted in the totals, but not split up into a provincial chart. So again, this chart shows the MAID provisions by jurisdiction from east to west. It is divided by the total number of deaths in that year and in that jurisdiction. So in this chart, we have 4 lines, one for each year from 2019 through 2022. So you can see the progression and the growth over time over these last 4 years where we've been able to really have these details and see the growth over time. So in this chart, 2019 is the bottom line and 2022 is the top line. So MAID provisions are counted in the year that the provision occurs. And this is how Canadian deaths are also recorded by Statistics Canada. And so it's in the year that death occurs. So recording MAID provisions this way, it allows us to compare the number of total MAID provisions in Canada or by jurisdiction and compare it to the total number of Canadian deaths in Canada or by jurisdiction as is reported by Statistics Canada. So that's how we get these percentages that you see on the chart. So as you can see in this chart, there's a lot of variability by jurisdiction. The heavy solid line in the middle, that's 4.1% in 22. So as I mentioned in the first slide, 4.1% of 22 deaths of MAID provisions. MAID provisions in 2022 accounted for 4.1% of all deaths in that year. So that's that solid line. But when you start to break it down by jurisdiction or by province in this case, you do see a lot of variability. That said, when you look at the 4 years, you can see trends that are really steady and increasing by jurisdiction year over year. So it's kind of the line follows each year. In 22, the percentage of total MAID deaths, it went from 1.5% in Newfoundland up to 6.6% in Quebec. Overall, we can see in 22, by the top line, that Quebec and British Columbia, they had the highest percentage of MAID deaths as a proportion of all deaths. This chart shows a MAID by main condition. It is for 2022, but it is actually quite similar for the 3 previous years, and that is 2019 to 2021. So if you were to go back and look at the similar charts in the 3 previous reports, it is quite similar over time. What we can see by this chart and looking at the purple line over the top, which shows the total, we can see that cancer at 63% is the most cited underlying medical condition amongst MAID provisions in 2022. And this is followed by cardiovascular conditions at 18.8%, other conditions 14.9%, respiratory conditions 13.2%, and neurological conditions at 12.6%. So you'll notice that when you add all these up, they do not add up to 100, they are greater than 100. And the reason for that is that more than one condition can be selected and actually is usually selected. So there is usually more than one, and we allow the practitioner to select all that apply. We can see by this chart has a gender breakdown. We can see by the dark blue bar for males and the red bar for females, there is a slight gender variation. It is quite similar overall. And overall, we can say that if we were to make one generalization, we can say that over 80% of the individuals having a MAID provision have cancer or a cardiovascular condition. All right, this chart here talks about the ages of the individuals receiving MAID in 2022. So in 22, what we can see here, so there was a slightly larger proportion of males overall. So you don't actually see it in the chart, but the calculation shows that 51% were men and 48.6% were women. The average age that MAID was provided in 2022 was 77 years old. So for females, this was 77.9 and males at 76.1. The average age has changed ever so slightly over time. In 2019 and 2020, it was 75, and in 2021, it was 76, and now 77. So that said, age trends have remained relatively consistent over the years. And in this chart, we can see specifically that the majority of provisions take place age 56 and higher. So there's just 4.5% that are age 55 and lower right here. There are slight gender variations within each category. We see the most gender variation at age 91 plus, and that is consistent with more females living into this decade than males. All right, this chart is really interesting. So at the beginning of the presentation, I talked about what the practitioner must report and how the practitioner will ask the individual requesting MAID some questions that will be included in the report. And the reason why this element is so interesting to me anyways is that this element is as reported by the individual. So it is the nature of suffering that the individual is feeling and that reports him or her, that pushes him or her to seek MAID. And so that's what makes this so very interesting. It is it's self-reported, as reported by the individual to their practitioner during their request for MAID, and it is reported as is by the practitioner. So what we can see in this chart is that the top 3 reasons that individuals cite as contributing to their request for MAID are the loss of ability to engage in meaningful life activities, the loss of ability to perform activities of daily living, and inadequate pain control or concern about pain control. And so these results actually continue to mirror very similar trends that were seen in the previous 3 years, shown in the previous 3 reports, 2019 to 21. And it really indicates that the nature of suffering that leads a person to request MAID has been consistent over the last 4 years. So that's very, very interesting. And more than one reason, again, can be selected. And so these reasons do not add up to 100%, they add up to greater than 100%. So a person is invited to select all reasons that apply or list any other reason that is relevant to them. So where does a MAID provision take place? This is another 4-year chart. It starts at the top bar with the blue line for 2019, and it moves to the bottom for the 22, which is the gray bar. Now, MAID mainly takes place in 4 locations. We have private residences, hospitals, palliative care facility, and residential care facility. So in 2022, we had 40% of MAID provisions that took place in private residences, about 30% in hospitals, and about 21% in palliative care facilities, and 7.6% in residential care facilities. There's some interesting trends over time here. If we look back to 2019, which was the first full year of detailed data collection under the original regulations, those 2018 regulations, but it was the 3rd full year of MAID after it became legal in 2016, we can see that MAID took place at similar levels in private residences and hospitals, with about 1/3 of total provisions in each location. But then you can see between 2019 and 22, if you look at the progression over the years, we can see the impact that COVID had in 2020 and 2021. So MAID in private residence moved up quite a bit to 47 and 44%, and MAID in hospitals declined. And that was, of course, as a result of the restrictions over time. So now we sit at about 40% at home and 30% in hospital. But since the location of MAID has shown quite a bit of variation over time, it will be really interesting to see how this evolves going forward. This chart looks at where MAID recipients live, whether they live in urban versus rural areas. And so one of the data elements that is collected in MAID reporting is the individual's postal code. And for this analysis of urban versus rural and where people live, we use the postal code in partnership with Statistics Canada to help us link to the status of that postal code, whether it be an urban status or a rural status. And then we also use census data from Statistics Canada to help get the Canadian trend. And that's the purple line that you see overlaid on this chart. That's the overall Canadian trend. So overall, what we can see is that the Atlantic provinces had a higher number of MAID recipients living in rural areas. So that ranged from 34% in Newfoundland and Labrador to 46.4% in New Brunswick. And the highest proportion of MAID recipients living in urban areas were from Quebec, Ontario, Manitoba, Alberta, and BC. It ranged from 79 to 84% of their MAID population being from an urban area. So more people ultimately live in urban areas from Quebec through to the west, and more people who access MAID live in rural areas in the east. That trend, or that result, is actually consistent as well with what we saw in 2020 and 2021. So it has been consistent over time. And so what is really interesting in this chart as well is that apart from seeing whether MAID recipients come from rural versus urban areas, we can see that the distribution of MAID recipients is roughly representative of each jurisdiction's general pattern of urban versus rural population distribution according to the 2021 census. So that's kind of neat, and you see that by the overlaid purple line. Who is providing MAID in Canada? So overall, what we see is that 85% of provisions are provided by a family physician, a nurse practitioner, or a palliative medicine specialist. And this breakdown has been very consistent since 2019. There are also small numbers of other specialists. Now, it's important to mention that each MAID provision, it does require a second assessment by a practitioner, a qualified practitioner. This is a required procedural requirement before all MAID provisions. As well, in 2022, 40% of MAID provisions, in 40% of MAID provisions, a practitioner did also consult with another healthcare professional to make their determination of eligibility. So these are additional professionals that are not counted in this chart. This chart only counts the practitioner that is providing the MAID, but there are many other healthcare professionals involved in supporting a MAID assessment. One of the questions that is asked, that the practitioner is asked to report, is a series of questions on the receipt of palliative and disability care services, and if they were received by the individual prior to MAID. So in 2022, 78% of individuals who received MAID also received palliative care services. And that's actually quite consistent with the majority of individuals having cancer as one of their main conditions, as we saw in the previous slide. Of those that did not receive palliative care services, 88% had access to those services if they were required. About 1/3 of individuals who received MAID also required disability support services, and of these individuals, 90% of them received these services. This data has actually remained quite consistent as well over the 4 years of reporting from 2019 to 2022. The current questions don't actually provide any information about the types of palliative and disability support services required or received. The new regulations that I mentioned at the beginning of this presentation, that started in 2023, will collect more information about this. And so I will talk briefly about those new regulations and the extra information that will be collected towards the end of this presentation. This is another 4-year chart. It shows some interesting trends over the last 4 years. The top green bar, it starts with 2019, and the bottom, or the gray bar, is for 2022. So most of the annual report, it does focus on reporting on individuals who receive MAID. It does account for the majority of requests that are received. Other than a MAID provision, there are 3 other main outcomes. Requests where the individual died of a cause other than MAID, requests where the individual has been deemed ineligible, and requests that have been withdrawn by the individual. So as we can see in this chart, in 2022, 81% of written requests resulted in MAID, and that's up from 71% in 2019. Looking at all the other requests combined, 19% of MAID requests resulted in outcomes other than MAID provision, and that's down from 29% in 2019. So in terms of what this represents in actual numbers, as we saw in the bar chart at the very beginning of the presentation, in 22, there were 13,102 individuals who received MAID. In 22, there were also 560 requests that were deemed ineligible, 298 requests that were withdrawn, and 2,144 requests where the patient died prior to receiving MAID. So the most common outcome other than receiving MAID is that the patient died prior to receiving MAID of another cause. So reviewing briefly, in 22, 81% of written requests ended in the administration of MAID. And we see that that has trended upwards since 2019 when we started collecting detailed information. Since 2016, it is possible that individuals have become more aware of MAID as an end-of-life option, and they are more familiar with the MAID eligibility requirements prior to requesting MAID. Regardless of jurisdiction, however, all MAID provisions require a written request, and they must be reported by the providing practitioner. Prior to publishing the annual report, Health Canada, it does benchmark or verify the totals with each jurisdiction to make sure that the report is complete and accurate. Now, that said, it is possible that there might be slight differences in the reported totals between Health Canada and a jurisdiction, and this largely depends on when the data is published. So Health Canada uses January 30th date to launch the reporting process for the previous year, and by this point, most reports have been received and analysis can begin. And a jurisdiction might use a slightly different date, which gives a slightly different total. So that's just to let you know that if you see slight differences, it's usually in the fine print. The total number of provisions are counted in the calendar year in which MAID occurred, as I mentioned earlier on, and that allows us to compare to total deaths as well in Canada to get our percentages. So requests not ending in MAID. In 22, 19% of requests resulted in outcomes other than a MAID provision. And as I said, most of these result from a patient requesting MAID but dying prior to receiving MAID. That was actually 13% of all 22 written requests, or 2,144 individuals. A small number of requests resulted in ineligibility for MAID, so 3.5% of written requests, or 560, and even fewer are due to an individual deciding to withdraw their request for MAID. So just 1.9% of written requests, or 298 requests. Again, if you're comparing data sources, there might be slight differences between what's in the annual report and what you may see reported by an individual province or territory. They may count things in a slightly different way. We count the requests in the year in which they are received. It is possible that a request may be received in, say, 2021 and come to conclusion in 2022. And so we count it in the year that it was received. It's all good. It's all in the fine print. So in the report, to help you understand and interpret the data, there are little fine explanatory notes under each table. There is also a section on methodology at the beginning of the report, which describes clearly how the report is put together. So if you really want to do a deep dive into the small details of a table that you see in an annual report, reading the fine print under the table can be helpful. All right, I did say that at the end or near the end of the presentation, I would briefly discuss the new regulations. So this is again the fourth key date that I discussed at the very beginning of the presentation. On January 1st of 2023, the expanded regulations came into force. And this expanded regulation requires all MAID requests to be reported, not just written requests. However, it doesn't include requests for things like general information about MAID. It must be a very specific request. There's a new section for individuals to fill out in these new regulations. These questions ask a person about their gender, their race or Indigenous identity, and any self-identified disabilities. So this is going to be an interesting area, like the nature of suffering, because it is personally reported by the individual. And why do we ask these questions? These questions will help to determine if there's any presence of systemic inequality in MAID access and provision, and as such, they can provide valuable information about requests for MAID. However, that said, individuals are not obligated to answer these questions if they are not comfortable doing so. It is not a requirement to receive MAID. There's also going to be an expanded section for practitioners to report on the individual's residence, so where they live, then their living arrangements, if they're living at home or with family, and the location where palliative care takes place, and the types of palliative and disability care services received. So that will expand that area of data that we already have and make it even more useful. There will be more questions for practitioners to assess individuals who do not have a foreseeable death. So that very small red bar that we saw at the top of the chart back at the beginning. And these types of questions will focus on things such as how the nature of suffering has been assessed, as well as the types of services an individual has considered to relieve their suffering. So all of this data is new. It is going to be collected in 2023. So it is being collected right now, and it will be reported next year in 2024 for the year 2023, and it will be our 5th annual report. This brings me to the end of the presentation. I look forward to your questions, and I will stop here for now.
All right. Thank you so much, Annette, for that wonderful presentation. That concludes, of course, the presentation part of our session today, and we're going to go ahead and get started now with some audience questions and answers. Thank you so much to our participants, as well as those who registered and submitted these questions. So we're going to go ahead and get started. First question, do you have any data on when and how MAID is being raised to the patients who request it?
We don't actually collect data on that, actually. That is a very interesting question. We do not have that data.
All right, thank you for that. Let's see, next audience member's question. Do you know how many people were approved for MAID but chose not to receive a provision?
That's reflected under withdrawal. So we do measure that quite specifically. And if you look at that table where I talk about requests that did not end in a MAID provision, that is under the withdrawal tab. It's usually very small numbers, but there is definitely a tracking of that.
All right, thank you for that question, audience member. Let's see, for next question, this audience member asks, do you have any insight into the 2,144 individuals who requested MAID but died before receiving it? Could it be due to a lack of providers in some areas, for example?
That is a great question, and that's going to be a twofold answer. Talks about the early regulations and the newer regulations. So for the original regulations, which is how we have published our data right now, we do not have that information yet. And so we thought too, that was a very interesting thing to look at and figure out, why is that happening? Why are people dying prior to a MAID provision? So under the new regulations, we do actually have a follow-up series of questions. It's a short question with about 5 or 6 points that asks exactly that. Why did that patient die prior to MAID? Answers could be such as they requested too late, or their condition progressed rapidly and they died before the assessment could be done, or other reasons. And so we really hope to be able to shed some light on that in the 2023 report that will be published next year in 2024.
Wonderful.
Hi, Annette. I was going to add one thing sorry, I'm Blaine Moninger. I work with Annette at Health Canada.
Welcome.
So one of the things I wanted to add related to that is that the recent changes to the MAID legislation brought in what we call a waiver of final consent. So before the waiver of final consent was possible, there was definitely, more people that were approved for MAID, but potentially died before receiving it because the practitioner needed final consent before they provided it to the patient. Now with the waiver of final consent, and that's only for those whose natural death is reasonably foreseeable, they do not have to provide, if a waiver of final consent is signed, and it's a written waiver of final consent, they don't need to provide final consent.
Wonderful. Thank you so much for that answer, Blaine, and thank you, Annette, as well.
Absolutely.
Next up, we have a suggestion actually from an audience member who is a MAID provider who also provides palliative care. This person says, it would be great if Health Canada could separate, quote, inadequate control of pain, quote, from, quote, concern about inadequate control of pain.
Indeed.
And same
Indeed.
for other symptoms, as these are two very
Yes.
different scenarios. She goes on to say, as a palliative care provider who's also a MAID provider, it'd be helpful to see how often actual symptom management issues are driving MAID requests rather than just the concern of these.
Oh, indeed. It is an excellent suggestion. And when we look at the 2023 data, we will look at all of those things, definitely.
All right, wonderful. Just checking, Blaine, if there's anything else to add before we move on.
No, that's good.
All right, thank you so much to our audience member for that question. Next up, how do you determine what is considered an outlier in the data collection process? Is there anything that you look for in particular?
That is a really detailed data question. I love that question because I love data. So when we look at the data, we parse it, I'd like to say, upside down, backwards, and sideways. Every single way you can think about it. Each file individually is examined, as well as sets of variables that form those tables. So we were able to very, very easily see if there is an outlier or if there's something that doesn't make sense. We will return to a practitioner, or as I mentioned, sometimes practitioners report to their province directly. So we will return to the province and we will seek clarification if we see outliers in the data. That can be things such as usually things like typos. Sometimes people won't write 2022, they'll write 22. It happens, and these things we know, and these are simple and easy to fix. Sometimes for birth date, we'll get today's date instead of the birth date. Who among us has not done that? So when we see things like that, because we have parsed the data forwards and backwards, upside down and sideways, we see all of these things and we do return to the provider or to the province and we seek a clarification on those elements to make sure that they're clean before they go into the report.
All right, wonderful. Thank you for that. All right, next question. Do you know how many people with dementia have accessed MAID since 2016?
That is a good question. We do not actually collect information on that specifically. That being said, there is a bar under main condition. So in that table where we talk about main condition and select all that apply, there is a bar that says other condition. It is generally a plethora of many conditions. You might see some random entries in there that will talk about memory loss, but it is not a variable that we specifically seek.
All right, thank you for that. Next question. Do you know the average length of time between the request of MAID and the administration of MAID, or the provision?
I do, actually. That is a great question. I believe that I have calculated that at 8 days as the
8
median.
days. All right, wow, thank you for that. Okay, next question. How will the enhanced reporting in 2024 help with future data collection? You touched a bit on this in your presentation, but if there's anything else you'd like to add or go further in depth.
I think it will help quite a lot. It will take some areas where we have data already. So an example, palliative and disability care services. We've been asking about if it was received, for how long was it received, was it accessible, but it didn't really complete the story. So now we're going to talk about, where was it received and what types were received. So I think that the new data elements in some areas, they expanded areas where we didn't quite have the full picture, and it will help us tell the story. It will also introduce new elements in other areas where we did not have any information at all. So one of those areas would be, we discussed previously, why did the patient die prior to receiving MAID? So that element, patient died prior to MAID. It will ask about the reasons for that. The other area that I discussed was the information that will be reported by the individual on race and Indigenous identity, gender identity, and self-perceived disability status. And this will really help us to understand the types of people that are asking for MAID, see if there's any systemic discriminations in the access of MAID. And so I think that these elements are really going to help to round out the story and really help us to understand who is asking for MAID, and then the reasons why people don't get MAID.
All right, thank you for
Yeah,
that.
I would add to that to say that we're going to be collecting a lot more information on track 2. So those are cases where a person's natural death is not reasonably foreseeable. So we'll be collecting data, for instance, on how long an assessment takes for a track 2 patient, and they often take quite a bit longer than for somebody in track 1. We're also going to be collecting, and I think Annette had mentioned this in her presentation, more data on requests for MAID that aren't put in writing, because what we've found and what we've heard from practitioners is often people make a request and may be found ineligible, but nothing is put in writing. So now we're going to try to capture that. So, potentially we'll see the number of requests go up vis-a-vis, the number of provisions. And we're just going through that data now. And I think the third thing I was going to point out is we're also going to collect data from preliminary assessors. So these are people that are non-practitioners, and all provinces don't have this, but some do, where a non-practitioner is actually, assessing a person for MAID. And before we updated the regulations, they did not have a reporting requirement. So again, a lot more data that you'll see in next year's report.
All right, thank you so much, Blaine and Annette, for that. All right, next question. How many MAID recipients chose to donate their organs, or do you have that data captured?
That is a great question. That's not the first time that I've heard that question, and that would be such an interesting data element. We do not specifically ask for it. However, that being said, there is a space in the form for supplementary comments, and sometimes we'll see a practitioner write that down, that a patient has donated his or her organs, but we don't specifically collect it, and it's really just anecdotal evidence at this point.
All right, thank you. Next question. I think you might have touched on this in the presentation. Do you have any data on MAID requesters that receive their provision at home versus in a hospital? And maybe we can circle back to those numbers for this audience member.
Absolutely, yes. So what we've seen quite a variation over time. At the very beginning, and when we first started collecting, it was kind of like 1/3 hospital home. You flip forward to 2022, it is now 40% at home, 30% in hospital. And there was quite a variation in between because we all know what happened with COVID, with the restrictions. So in 20 and 21, there was more provisions at home in the 40%. So right now we're sitting, 40 at home, 30 in hospital, and others in palliative care facility and residential care facility. But there has been a lot of variation over the last 4 years. So it's hard to say how that will continue going forward. And that's a really interesting trend that we're going to monitor closely, but that's where it sits right now.
All right, thank you for that. Next question. Let's see here. Is there a significant difference between rural and urban centers accessing MAID? And this might be difficult to answer off the top because it's, of course, different according to each province and territory, but if you'd like to take a crack at it.
So we do have that chart of where people live when they receive MAID, and what we did find was that it is roughly representative of the urban versus rural distribution in Canada according to the census. So that's the chart that I did in the presentation with that purple line overlaid on the top. That shows what the census says, and then the other bars show what we see. So we do see that there are more urban MAID recipients in the east. There are more rural MAID recipients in the east, and more urban MAID recipients from Quebec through to the west. And that is roughly representative of how Canada's population actually lives. So that's for MAID provision. For assessments that did not end in MAID, we haven't actually specifically drilled down to that area. And I think that might be interesting to see, if we did do that, to see what we would see. Now, we haven't presented that in the report. One thing that I did not discuss in the report or in the presentation that I might mention now is there are so many different ways to splice data. I like to say you can cross anything with anything. And so what we've done in there is we have presented what is legislatively required. We have also presented other things that we think are interesting and useful to inform our stakeholders. We have presented things that stakeholders have asked for, and then now we make a list of things that we hear that people might want to see and what we might want to present going forward. So we're always evolving, and if you're on the website looking at all 4 reports, you'll see that evolution, that each report is similar in format, but it is slightly different. And this is as we respond to things that are going on and things that we hear and things that have been requested. So I'm going to take note of that, and thank you for bringing that.
I will also add, Annette, that there are medical researchers in Canada that use the data for their own research and have published articles. So those are things that you wouldn't see in the annual report, but are published in journals. And there is a lot of, so there are a lot of experts and researchers that are accessing the data and using that, for their own research that they're publishing.
Indeed, yes, an excellent point.
All right, thank you so much, Annette and Blaine, for that. Next question. This audience member asks, how many applicants are denied MAID? Do you happen to have data on that?
So that goes back to that chart that I did near the end of it, where we talk about the requests that do not end up in MAID. So in 2022, we had, off the top of my head, 81% of requests ended in MAID, and then the other requests ended in reasons that were not made. Now, the majority of those are patient died prior to receiving MAID. And then we have a few that are ineligible. I believe it was 568 if memory serves, but it is in that chart. And then we have 200 and some odd, 298 that withdrew. So we do have the very specific number, and it is in that chart. It is also declining over time if you look at the range of the trend between 2019 and 22.
And again, it's important to note that's based on written requests.
Yes.
So often, a physician may see somebody that they feel isn't eligible and would tell them that, and it would never end up in a written request. So that's where for next year's data, you may see an increase in, persons that were found ineligible, because we're trying to capture non-written requests for MAID for next year.
Correct, yes.
Thank you for that, Blaine and Annette. Okay, next question. Emma, we'll pose this to both speakers, of course. What was one new learning that you had in 2023 from the report that stands out?
That is a good question. There was, I guess, every year for me, what is the most interesting thing is to see the trends. That's what I find the most interesting. So I think that's the thing. I think I see things that are very consistent year over year, and I find that very interesting. And then I look at the trends and see how things have changed. So one of the things that popped to me this year was the location of MAID and how that has not gone back to the original 2019 levels, that it's still more at home than in hospital. And I found that to be a very interesting finding, because we were wondering if that sort of switch to home during the COVID restrictions was going to stick. And I feel like it is sticking to some extent. And so I found that really interesting myself, but I also find that sometimes when things stay the same, that's also really, really interesting. And it just really shows that the nature of things is quite consistent over time.
Yeah, I think for me, it's the high, relatively high numbers compared to other jurisdictions of MAID provision in Quebec. So that would be, a really interesting, I think area for a researcher to look into to understand, why does it seem to be higher in Quebec? Is it a issue of better access? Is it an issue of it's more socialized in Quebec? It's really hard to know exactly why it's higher in Quebec, but I think it would be especially if those trends remain the same, it would be an interesting research topic for somebody to look into. And the other thing that I found interesting, and Annette, I don't know the number off the top of my head, you probably do, is the number of unique providers. I think it's over 1,500 now, right?
It is. I didn't put that slide in here, but it is in the report, and I believe that it's somewhere in that range. Yes.
Yeah. So I mean,
Yes.
just the number of
It's a lot. Yes.
physicians and nurse practitioners in Canada that are actually providing MAID. I think when I, started working on MAID a couple of years ago, I just had no idea that there was so many,
So many.
practitioners that were providing this. And again, that most provisions are done by family physicians. It's not specialists.
Indeed. And then there's the other point that was made that we don't even count the ones that do the second assessment or the additional 40% of cases where there are consultations. So that is a whole lot of people that are involved in MAID that are not even counted in that official total. So it is very, very interesting to see the number of people active in this area.
Yeah, and I will point out one more thing is we recently released a national MAID curriculum. So that was working through CAMAP, which is an association of MAID assessors and providers, and we're seeing the uptake, for training to be huge amongst the practitioner community, with over 900 practitioners already signing up to take the training. So it just shows that, I think there's a lot of, again, physicians and nurse practitioners that are involved in MAID in Canada.
Certainly, and maybe just to ask a follow-up question, certainly it'd be interesting to see what those number of practitioners will be for the 2023 report, but I just wanted to ask if anybody knows off the top of their head if the number of practitioners has increased by any percentage from 2021 to this current report this year.
It has, yes, we have reported that. I didn't put that in this slide. It does increase every single year. I think the important point to make here, though, is that it doesn't increase at the same level as MAID provisions increase. And that is the key point, is that there are fewer providers, like the growth is higher in the request and the provision of MAID than it is in the number of practitioners providing MAID. So each one is growing, but the number of provisions is growing faster. And we do have specific charts on that if you want to do a deep dive on that in the annual report. The other thing we have is we do show it over time as well. So how it has increased from 2019 to 2022. But that important point to show that the growth of MAID is really strong, and the growth of practitioners, whilst growing, is not growing at the same rate.
All right, thank you both for that answer. All right, so for next question, this audience member asks, do you have any data on requesters who accessed medical assistance in dying with support, and they're referring specifically here to family members or loved ones, versus requesters who are alone?
We do not specifically collect that. In fact, we don't collect that at all. But what I'm going to say, though, is that I feel like we'll have some interesting information to share in 2023 about that, because we are asking in this year about the what a person's living situation is, so where they are living, and if they're living at home, are they living alone or are they living with family? So I believe that we'll be able to get at it in that way this year for the 2023 data, which we'll report next year. This year, we're not actually collecting anything like that would shed light on
All right, thank you for that. Next question. This audience member asks, do you know if requesters who were denied MAID in one jurisdiction ever received it in another jurisdiction? Do you have any data on that?
That is a question that I have been asked before. We do not specifically report on that. It is not impossible that that would happen, but I haven't really seen any trend or evidence for that in the data.
Okay, thank you for that. Oh, Blaine, I see you wanted to jump in there.
Well, I was just going to say it is something we're going to start collecting. We've started to collect data on for this year. We'll see if we get enough data to be able to report it, though.
Yeah.
So, I mean, no promises. It could be a fairly low number that's reported, because it would only be when a practitioner knows, right? So they could ask a person and the person could say, no, I haven't, sought a MAID assessment anywhere else, but they may not be truthful about it, right? I mean, there may be some in their best interest for somebody to tell, a physician that they haven't had a previous assessment, but we have asked that question. So we'll, we'll see if it's reportable in next year's report.
Yes, we have asked that question. The other thing to consider is that the point that Blaine previously made is that we are going to be tracking all requests, so not just written requests. And so that may increase sort of the number of applications that we receive. We also do collect the HIN, which is the health insurance number of an individual, and that is a unique number like a SIN or anything like that. So we are able to do analysis on that if it indeed becomes an area that we want to deep dive into, and if we have the numbers to support it, because as I discussed earlier as well, confidentiality is a big issue when the numbers are very, very tiny. It's not somewhere that we can go or that we can report. So we'll see what the future brings, but there are ways to look at that.
All right, thank you so much for that. Next question. Let's see here. This audience member asks, are retirement homes captured under what you qualified as residential care facilities?
No, they are not. No, they are not considered residential care facilities. They are considered private residence. A retirement home is a private residence. So when you look at that breakdown about where MAID is provided, we consider a retirement to be a private residence, so at home. Likewise, in future, as we go forward in the 23 data under the new regulations, we do ask about a person's living status, and a private retirement residence is a private.
Wonderful. And maybe just to ask a follow-up question to therefore clarify, what would you consider then to be a residential care facility? What might be some examples?
Sure, yeah, that's more of a long-term care facility. So where people with conditions that require medical assistance, they will live in longer-term care facilities. So more of a longer-term thing, or it could be end of life as well, but not necessarily at the end of life. That could be palliative care. So long-term care is a mixture of people. It could be people that require support at the end of life, but they are not yet ready for palliative care. They are not able to live independently. It could also be people that live in sort of these residential group settings that require years of support and care.
Wonderful. Thank you for that. All right, next question. And I think you touched on this with the new data recapture requirements for 2023, but this audience member asks, and maybe we can just discuss, the current reports or previous. Do you have any data on the percentage of requesters from different ethnicities? Is any of that captured at present?
That is a great question. Lots of people would like to know, and that is included in the new regulations. And so we are starting to collect that this year. We have listed the indigenous, requesting for the indigenous status if a person would like to identify as that. We have the race as well, and we have tried to benchmark it to the categories that more or less that Statistics Canada uses in their census, so that we were able to do a comparison when we get our numbers against the benchmark for Canadian numbers. So that will come out after 2023. Or for 23 in 24, but not for the previous 4 years, because that's not information that we have collected, but we will collect going forward.
All right, thank you for that. Next question. How does Canada compare to other countries that provide an assisted death program? And you might not be able to answer that within scope, but this audience member is curious if you have the answer.
That is a good question. Blaine, I'm going to throw that one over to you.
Yeah, I mean, sure, it's a very broad question, but
question.
typically when we, compare the Canadian regime, we compare it to the Netherlands and Belgium, which are similar, but not the same. I mean, they have different models of healthcare delivery, much more centralized federally in those countries. And our numbers are similar, you'll find if you look. So they publish annual reports. I think the last one I looked at, which was from the Netherlands. There's a bit of a lag because they don't publish it in English right away, but they do translate it and publish it a year or two later in English. And the trends are quite similar to what we see in Canada. Their overall provision of MAID in terms of the total number, MAID as a total number of deaths in the country, I think is over 5%, where we're 4.1%, although they've had MAID legalized for longer than we have. So yeah, I mean, it is an interesting, I think again, most comparable to those two countries, and there's a lot of similarities with some differences, and a lot of the differences have to do with how healthcare is delivered in Canada compared with those jurisdictions. But the safeguards are roughly similar.
Wonderful. Thank you, Blaine. Thank you to that audience member for that question. This audience member asks, is Health Canada interested in capturing data regarding an individual's income from people who have accessed MAID?
Yes, that is a very interesting question. And that is something we have definitely looked at. We don't actually collect it, but in data analysis, there is always the possibility of linking to other data sets. And that is something that we are actually currently exploring and hope to be able to provide some information on at some point in the future.
Yeah, it is actually a commitment that we made
Yeah.
around the time of Bill C7, is to try to look at
Yeah.
income data. So it is something that, as
Yeah.
Annette said, we're exploring.
Yeah, it may not be next year, but it is definitely in the works, and we'll see what comes in the near future. Not promising for the next year, but definitely in the near future.
All right, wonderful. Thank you for that. Next question. This audience member asks, do we know what percentage of MAID provisions that were offered at home are a result of forced transfers? So again, that's facilities that do not permit provisions or assessments on site, and the patient thereafter has to be moved.
Right. No, that is a great question. Now, we are actually not capturing that currently, but we will capture that going forward in 2023 and going forward. So can't answer it yet, but we'll be able to answer it going forward.
Wonderful. Thank you for that. All right, next question. Let's see here. We have just a couple more minutes. Thank you so much to our audience members for submitting. Let's see. Okay, this audience member asked, this is about different jurisdictions. In BC and in other provinces as well, the health authorities are quite autonomous, while in some provinces it's more centralized. Talking about the health authorities that oversee the MAID program, do you have data specific to regions who are autonomous?
So if we're talking just about reporting, I touched briefly on how reporting is done. So we do have some regions in the east, including the 4 eastern provinces, as well as a couple of the territories up north and Manitoba, that report directly to Health Canada because they are more, shall we say, decentralized. And they don't have sort of a central reporting authority. So their practitioners go online and they report their data one report at a time. We have 5 other provinces that report to their own central reporting authority. So that would be Quebec, Ontario, Alberta, Sask, and BC. So those 5 report directly to their own centralized body, who in turn sends it to us. So that's in terms of reporting. And so that's how it comes to us that way. Eventually it all ends up here, but how it comes here is by 2 different routes.
Wonderful. Thank you for that. All right, I think we've got time just for a couple more questions here. Do you have information on how long, on average, it takes from the request to the first assessment?
We do not specifically ask that question currently. So what I can tell you, or all I can tell you, is, as I previously told you, that I believe I have calculated it. I didn't present it today, but I believe that it is 8 days from the date of the request to the provision made as a median. There is quite a range, of course, but we do not specifically ask for the date. We ask for the date the request was received, but we do not specifically ask for the date where the assessment started. Now, that being said, in 2023, we are going to expand questions on for folks that are not reasonable foreseeable natural deaths. So there is quite a few more questions for those folks, that small sort of red sliver that we talked about at the very beginning of the presentation. And one of those questions will ask exactly that, the date that the assessment started. So in theory, we can calculate the differential between the date that the request was received and the date that the assessment started, to see if there's any interesting data or information that pops from that calculation. So we'll be able to do a little bit of that, but just bearing in mind that that is a really small sample. And so we'll see what comes out of that and if we're able to say anything interesting about that. But really, the majority, as we know, 97% of MAID provisions are in cases where death is near. And we can say that within 8 days in general, that is the average or the median between the date of the request and the date of death.
All right, thank you for that. Okay, next question. Do you know how many persons with a loss of capacity received MAID after having signed a waiver of final consent? Do you happen to have captured data on that?
Yeah, that's a great question. So we have not consistently collected that in the last 4 years, but we are collecting that going forward. So we will have that information going forward for 2023 on. So we do not ask necessarily how many people have a waiver in place, but we will ask the question, was the waiver used? So starting in 2023, we'll be able to know for the people that received MAID, was that waiver used? So therefore they would have lost capacity and was that waiver used? So we'll be able to report on that starting next year.
All right, thank you. Okay, we've got one more. We've got time for one
Yeah,
more question here.
absolutely.
And Blaine, you touched on the new curriculum provided by
Mhm.
CAMAP. So this audience member asked, do you plan to collect data on the number of practitioners being trained on MAID as a framework
Mhm.
over time?
Yeah, so that data is not being collected through the annual report, but we are, tracking the number of practitioners that are taking the training. So we have that as a separate,
Mhm.
statistic that we're gathering. I'm not sure, in terms of how we'll present that information,
Mhm.
because again, it isn't part of the annual report. The annual report is really about assessment and provision of MAID. It's not about, sort of the other things related to MAID, such as practitioners training.
All right, thank you for that. Just want to check if Annette, you had anything else to add on?
No, that covers it really well. I mean, there are so many different things that we can talk about in with regards to MAID, as I said at the very beginning of the presentation. Um, and the report itself really does focus on the legislative requirement to report. At the top end of the report, we'll have a brief historical about the law and about the regulations, certainly about the methodology in the report, but is not intended to be comprehensive in all of those areas because we have so many other resources that sort of touch on those things. And so if people want to explore that, they should explore further on those links that I provided.
All right. Thank you both so much
Mhm.
to our speakers for today. We are now unfortunately out of time.
Mhm.
Thank you so much to our speakers for joining us today. Thank you to our audience members for submitting those
Yeah.
wonderful questions. We hope that everybody has a wonderful day. And just a reminder that the session is recorded. So if you need to revisit it or if you missed out on today, it will be posted on our website. And of course, for any deep dive questions, the 4th annual report is published and available for all Canadians to access on website. And we will also have that in our follow-up email as well for folks that want to access the report. Annette, Blaine, thank you so much for
Mhm.
joining us.
Thank you.
Thank you.
Wonderful. Everybody take care and have a pleasant afternoon. Bye-bye.
Bye-bye.